So in this project we collect women to do an HPV test, and after that they got a screening if the HPV is positive. And then it's good to know how does the infection works, and how do you get from an HPV infection, how can it be cervical cancer. So I brought you this picture about the how we do it in the field as well. So we do a gynecologic examination, and then we can see only the mouth of the uterus. The uterus itself is like a pear-shaped organ in the pelvis of the woman, and what we see is like this. It's kind of donut shaped part of the uterus, which we call the cervix. And the cervix, is important to know, they have inner cells and outer cells, and there are two different types of cells. And on the border of those two cells, that's where HPV is prone to infect the organ over there. And when HPV is there, it can change the cells, and then from changing cells from a pre-malignant lesion, it can become a malignant lesion, cervical cancer. So the first thing to do is to check if there's HPV, yes or no, and if there's HPV found, then we call the woman for screening, and we screen them then, and then we put some fluid on the cervix with acid in it, and the acid tells us if there's pre-malignant lesions, and we can see them as whitish spots appearing on the cervix like this. In Uganda and in this project we discussed about this as well, and we decided also to treat all the HPV positives. So without or even if when there is no lesion visible but they are HPV positive, we will treat them, and we will do a thermocoagulation of this whole area to destroy the cells that are possibly pre-malignant, to prevent them for cervical cancer.